Something quietly changed in 2026 that's already costing millions of American seniors more money every single month. And most of them have no idea it happened. It's not breaking news, there are no headlines about it. But if you or someone you love is on Medicare right now, this affects your wallet, your prescriptions, your doctor access, starting today. And here's what makes this worse. There are also changes this year that could save you thousands of dollars, but only if you know about them and act on them. So, in the next few minutes, I'm going to walk you through every major Medicare change in 2026, the ones that hurt, the ones that help, and the ones that most people are completely sleeping on. Let's get into it. For the first time in Medicare's history, the monthly Part B premium has crossed the $200 mark. In 2025, you were paying $185 a month. Starting in 2026, that number jumped to $202.90. That's a nearly $18 a month increase, or about $215 more per year, coming right out of your pocket. Now, I know $18 doesn't sound catastrophic, but here's what people miss. If you're on Social Security, that Part B premium gets automatically deducted before you even see your check. So if you were expecting your Social Security payment to feel a little bigger this year thanks to the cost of living adjustment, surprise, a big chunk of that increase just got eaten up by this premium hike. And it doesn't stop there. The Part B deductible, the amount you have to pay before Medicare starts covering things like doctor visits, outpatient surgery, or medical equipment, that went up too. It's now $283 a year, up from $257 in 2025.
If you end up in the hospital, the Part A deductible for inpatient stays climbed to $1,736 per admission. That's $60 more than last year. So across the board, more money is coming out of your pocket before Medicare covers a single dollar. Now, before you panic, there's actually a program that could eliminate that Part B premium entirely for low-income seniors, one that 1 in 4 eligible seniors isn't even enrolled in. I'll tell you exactly what that program is and how to get it. But first, let's talk about the change that could genuinely save your life.
Here is the good news, and it's genuinely good news. If you take prescription medications through Medicare Part D, and most seniors do, there is now a hard cap on how much you'll ever pay out of pocket for your drugs in a single year. That number is $2,100 in 2026. Once you hit $2,100 in covered prescription drug costs for the year, Medicare pays the rest. Every bottle, every refill, zero out of pocket for the remainder of the year. Now, you might think, $2,100 still sounds like a lot. And yes, it is. But consider where we were just a few years ago. Before recent reforms, that out-of-pocket cap was as high as $8,000 a year. People were choosing between their medications and their groceries. That's not an exaggeration. This cap changes everything for seniors managing cancer, autoimmune diseases, heart conditions, anyone on expensive specialty medications. And there's more. If you're on insulin, your cost is still capped at $35 a month. That's a protection that stays in place in 2026. If you have a family member with diabetes, that's not a small thing. That's potentially life-changing. There's also something called the Medicare Prescription Payment Plan, a new option where instead of paying a giant lump sum at the pharmacy early in the year when you haven't hit your deductible yet, you can spread those drug costs out over 12 equal monthly payments. It's essentially a payment plan for your medications, built into the system. So yes, Part B went up. But for anyone managing serious health conditions, 2026 actually brought some real financial relief on the drug side. Coming up, the Medicare Advantage trap that's snaring thousands of seniors right now, and how to make sure you're not one of them.
Let me tell you about one of the most frustrating things that happens to Medicare Advantage enrollees and why 2026 finally does something about it. Here's the scenario. You're shopping for a Medicare Advantage plan. You check the plan's provider directories online. You see your doctor is listed as in-network. You sign up. And then a few months later, your doctor tells you they don't actually accept that plan. This happens constantly. Provider directories in Medicare Advantage plans are notoriously outdated. People get locked into plans based on bad information, and then they're stuck. Starting in 2026, Medicare has a new rule. If you enrolled in a Medicare Advantage plan and later discover that your doctor or hospital was incorrectly listed as in-network, you have a 3-month special enrollment window to switch to a different plan. That's a brand new consumer protection, and it matters. Also worth knowing, the average monthly premium for Medicare Advantage plans actually dropped slightly in 2026, down to about $14 a month from $16.40 last year. And standalone Part D drug plan premiums also dipped, averaging around $34.50 a month, down about $4 from 2025. So while original Medicare costs went up, Medicare Advantage premiums went down on average. That might be worth comparing for your specific situation. But here's the catch with Medicare Advantage. Lower premiums don't always mean lower costs. You still need to check your network, check your drug formulary, and check your out-of-pocket limits before switching. Now, remember that program I mentioned that can literally pay your Part B premium for you? Here's everything you need to know.
This is the section I need you to really pay attention to, because this could be worth hundreds of dollars every single month. It's called the Medicare Savings Program, or MSP for short, and it's a set of state-administered programs that can pay some or all of your Medicare premiums, deductibles, and copays, depending on your income. Here's the staggering part. An estimated 1 in 4 seniors who qualify for this program are not enrolled in it. That means millions of people are paying $202.90 a month for Part B out of their Social Security check when the government would pay that for them. The general income threshold for the most common version of this program is around $1,800 a month for a single person, though it varies by state. If your income is anywhere near that range, it is absolutely worth a phone call to find out if you qualify. How do you apply? You go through your state Medicaid office, or you can simply call 1-800-MEDICARE and they'll point you in the right direction. It takes about 20 minutes and the savings can be immediate. If you qualify for extra help, the low-income subsidy for Part D drug costs, that's a separate program that can save you up to $5,500 a year on prescriptions. Same application process. I'm not going to rush through this because it's genuinely one of the most underutilized financial lifelines in the entire Medicare system. If you know a senior who is struggling to pay their bills, please share this video with them.
A few more changes in 2026 that are worth putting on your radar, especially if you're in a Medicare Advantage plan. First, Medicare has tightened the rules around prior authorizations. If a Medicare Advantage plan approves your hospital admission, they now have to honor that decision. They can't come back after the fact and reverse it based on information they gather after you're already admitted, unless there's obvious fraud or error. This is a big deal. Prior authorization denials have been a massive problem in Medicare Advantage, and this rule closes one of the more egregious loopholes. Second, Medicare is launching a prior authorization pilot program in 6 states for certain services and equipment under traditional Medicare. If you're in one of those pilot states, you might encounter some new steps before getting approved for certain procedures. Your doctor's office should be aware of this, but don't be caught off guard. And finally, the supplemental benefits in Medicare Advantage, things like dental, vision, and hearing coverage, those are being restricted in 2026 to only include benefits that have a direct, measurable impact on health outcomes. Some plans are cutting extras that weren't actually improving health. That might affect what your plan offers this year compared to last year. If you haven't reviewed your plan documents for 2026 yet, do it this week.
Let me leave you with a simple checklist. These are the things you should do or review right now in 2026. 1. Check what you're actually paying for Part B each month. If you're on Social Security, look at your benefit statement. You should see the $202.90 deduction. 2. If your income is below roughly $1,800 a month as a single person, look into the Medicare Savings Program immediately. Call 1-800-MEDICARE to start. 3. Review your Part D drug plan. Make sure your medications are still on the formulary at the same tier. Plans change their drug lists every year. 4. If you're in a Medicare Advantage plan, verify that your doctors and preferred hospitals are still in network for 2026. 5. If you were enrolled in the Medicare Prescription Payment Plan in 2025, it auto-renews this year unless you opt out. Check your plan documents. 6. Remind yourself, your out-of-pocket drug cap this year is $2,100. Once you hit that, your covered prescriptions are free for the rest of the year. Medicare is complicated, but it doesn't have to be confusing. That's exactly why this channel exists. If this video helped you understand your Medicare coverage better, please share it with someone who needs it. A parent, a neighbor, a friend who's been putting off dealing with this stuff. It could genuinely save them money. And if you want to go even deeper, watch the video coming up next. Take care of yourself, and we'll see you in the next one.